webinar, special webinar that we have had, that we are organizing today on socioeconomic implications for vulnerable sections, especially women, which has been done by, the team has been led by Professor Tanuka, and this is a joint project between UNICEF and IHT. To chair the session today, we have Professor Meenakshi Rajeev from Institute for Social and Economic Change, Bangalore. Professor Rajeev herself has done lots of work in these areas, and of course, her specialization is banking and industrial economics, labor economics, development economics. She herself has done her PhD from Indian Statistics Institute, Kolkata, and she's also done her MSc from the IIT Kanpur. She's been at ISAC for long now, and she's known to do lots of empirical research. She also is at present occupying the RBI chair of economics at Institute of Social and Economic Change. With this, I would like to invite Professor Meenakshi to chair the session, introduce the speakers, and take the proceedings further. Professor Meenakshi, please.
Thank you, Professor Charan Singh, for giving me this opportunity for such a seminar on such a relevant topic, because as we all know that this COVID-19 pandemic has created a kind of unprecedented disruption across the globe. And this disruption is not in terms of economy, but it's also in terms of society and social issues. So India is one of the worst affected countries, as we all know, and therefore it is also get affected both in terms of its economic condition as well as in terms of various social indicators and aspects. Now, also, we know that recently coming out statistics that in global hunger index, we have gone down to 101 position with a score of about 27.5, which is really a serious concern. So there may be some kind of concern about our limitations of the measurement of hunger index, etc. But what Professor Amartya Sen says that even with these limitations, this hunger and malnutrition is still a very serious concern for India, and it affects our children and lactating mother and all. And at this juncture, with COVID-19, the situation of such vulnerable sections may have gone even to much worse condition. And at this point, IHD and together with you partnering with UNICEF has done this very important study to generate evidence for policy making, focusing on the vulnerable section, the impact of COVID on issues such as livelihood, such as children's education, health, and so on and so forth. So it's a very relevant and timely study. I just quickly want to also mention to the audience in general that we at EGROW also is quite involved in researching on the socioeconomic aspects of COVID-19. EGROW has conducted a panel session involving its own experts in psychology, in sociology, in economics, and in health economics in one platform as a group. We have conducted panel discussion. We are also as a group from different disciplines are meeting and discussing these issues and bringing out research output for policy making. Now at this point, we are very happy that Professor Tanuka has agreed to give a seminar on this issue. And let me briefly introduce Professor Tanuka. And she is a professor at the Institute for Human Development, and she did her PhD from University of Calcutta. MA from Delhi School of Economics and BSc from the Presidency College, Calcutta. She has worked extensively in the areas of education, including issues of out of children and as well as low-cost private schools and other education-related issues. She has worked on human development reports of various states, including Delhi as well as Uttarakhand. And she was also engaged in preparation of vision document for Uttarakhand and Delhi based on sustainable development goal. She has a large number of research paper to her credit. And I also, together with Professor Charan Singh from the EGROW platform, welcome you and very happy to have you here. And floor is yours, Professor Tanuka. You have about 40 minutes.
Thank you, Professor Meenakshi. And first of all, thank you, Dr. Singh, for inviting me to share the findings of this joint report between UNICEF and IHD, because I think it is really a great chance to disseminate, the voices of the marginalized communities who generally go unheard. But this study brings out their voices directly from the ground for disseminating to others as well as policymakers. And we are really hoping that, evidence based on this will help the policy to go forward. So I'll just at the outset, let me mention that this study covered the period between May and December 2020. So it does not really cover the second wave of COVID. So it is really pertaining to the effect of the first wave. So I'll just share my presentation. Yeah. Basically, let me just. Why it's not moving? It's moving forward. Okay. Sorry. So I'll start with the aim of the study. Sorry, I'm a little not used to this platform. So the aim of this study is to generate evidence and a quick analysis of the effect of the COVID-19 pandemic on the marginalized communities and families. So what are the areas where the idea was to see the effect on livelihoods, on goods, access to goods and services, health and hygiene, social protection measures, and so on. And very importantly, to provide evidence-based tools, to the policymakers, because already such marginalized communities, they're already in a very inequitable position vis-a-vis the rest of the society. So one doesn't want those inequalities to be further exacerbated. Okay. So, sorry. So next is the coverage of the study. As you can see, it was covered in 7 states and across 12 districts. As you can see, 6 rural, 6 urban, and the geographical locations also you can see. The assessment took place over 4 phases and ending in December 2020. And so I'll just go to the next slide to show that, how this, at the time of COVID pandemic, as you well know, that it was impossible to go and do surveys, face-to-face household surveys. So UNICEF really took this initiative to come out with a very innovative method of data gathering, and which my partner, Mr. Maiti from UNICEF, he will elaborate on it later. I will just mention a couple of points. So they collected the data with the help of civil society organizations, and they who have a network of community volunteers who work in the communities. So they were used to gather data directly rather than send investigators for household surveys. In the first phase, around 5,000 households were covered, and the other 3 phases, around 6,000 households each were covered. And where the organization I belong to, which is Institute for Human Development, IHD, we came in where we partnered with UNICEF for data processing, analysis, and the preparation of the report. So I'm just going ahead with the findings, which are the key issues, covering 4 phases of assessment. So focus is obviously, as you already know, because it's UNICEF, got to focus on children and women. And that is, I think, one of the unique features of this study. It is not just livelihood. Of course, economic sector is there, including livelihood, access to food, social protection. But in health and nutrition, you will have responses from various women respondents, which we will come to later. It also covered COVID-appropriate behavior, vaccine hesitancy, education and social protection, child protection and gender-based protection, as well as a little bit on local governance. Now, lockdown led to rise in joblessness. I think we mostly know that. Everybody here knows that. And later on, as progressively there was economic recovery and there was steady unlocking of the economy, there was subsequent recovery of, improvement in the job position also. But wages were lower. So what did they find? So the main earners of the household, they were asked one question, that what is your current main occupation? And mostly the maximum share came out to be casual workers. There was some percentage of regular employers also, like who get the regular salary. And there was some jobless even in the pre-lockdown period. So what happened was in June, July, there were current status information collected as well as information collected for pre-lockdown status also. And we saw, as I will show you in the next slide in the graph, that the share of the jobless in the total respondents of main earners, that really became highest. So the situation was worst in June, July. In urban, it was 26% of the total respondents, and in rural, among the rural communities, it was 20%. But subsequently, as we said, that there was a recovery and the jobless shares declined to pre-lockdown levels by December to 8 to 9%. But there was a change in the structure of employment because there was an increase in the share of casual workers between pre-lockdown and December. And at the same time, there was a decline in the share of regular employment. So, and in keeping with this, because regular workers usually get a better salary, casual workers are lesser paid. So we find that in December, nearly three quarters of the urban respondents and 60% of the rural respondents, they said that daily wages were less in December compared to the pre-lockdown level. So we have higher employment recovering, but at lower wages. So if you see these graphs, it shows you very clearly in the rural districts, you can see it's peaking, the jobless share, the gray graph, it is peaking at 20% roughly. But in the urban, it is 26%. And later on, these are all declining. But the regular share, regular employers share, it is not getting back to the pre-lockdown level. On the other hand, the casual workers share is exceeding the pre-lockdown levels. Okay. So next we come to the food situation. And we all know again that, following the COVID pandemic and the lockdown, there was a massive impact on availability of food among the poor and the vulnerable communities. So what the main earners were asked was that, are there food items which are said rice, wheat, oil, pulses, so that you can provide at least 2 daily meals for your family for the coming week, for the next week. But as you can see, even in December, only 64% of the urban respondents said that they have enough. Rural percentage was higher at 78%, but even there it's not 100%. And urban, definitely, so many families did not have adequate. And another fallout of the food situation was that there was a pressure on consuming protein-rich food. The consumption basket changed. How? Because the protein-rich food, and the secondary data shows us actually there was a lot of food inflation also. And there was, protein-rich food, meaning milk, eggs, fruits, vegetables, these. So these, 1/3 of the respondents said that in October, November, and in December, that is in phases 3 and 4, they spent less on protein-rich foods compared to the pre-lockdown levels. So it has a direct impact on children because children need milk and fruits, those protein-rich food. So it would very likely have had a direct adverse impact on the children's development. Now, what was the lifeline during those times, this absolutely calamitous times? Public distribution system definitely came to people's aid, and MG was a lifeline among the rural communities. The study found fairly good access to PDS ration cards. For rural, it was around 88, but urban was lower at 76%. So it was not universal, definitely, but still fairly high. And among those who got the ration card, who had the ration cards, they also, most of them did draw a ration. Yeah. And about Manrega work, we found that 60% of the sample population and 50% in October, November, and 50% in December, they sought the Manrega work. But here what I have not said is some of them did not get, although they sought, because they could not get the job card because it had not been processed, their application had not been processed, or sometimes they did not have the requisite documents. So there were some procedural bottlenecks. About timely wage payment, it was 41% got timely wage payment in October, November, but it improved to 62% getting timely wage payment for Manrega work in December. Now, we all know about what we usually call the migrant workers, who are being called home returnees here. These are all the workers in the urban areas who suddenly, following the lockdown, lost their livelihoods. And they had to go back, sometimes alone, sometimes with their family. They trudged huge distances back to their homes in villages. And they were definitely one of the most vulnerable groups compared to the average households. Similarly, female-headed households, they were also very vulnerable. And home returnees were purposefully kept at a fairly high share of 28-29% of the total sample. Female-headed households were 17-18%, but the share was in the urban areas was much higher compared to the share in rural areas. In urban areas, it was 20 to 25% of the main earners were the female-headed families. How were they vulnerable? They were vulnerable in terms of share of jobless households. More people were jobless. A high proportion were jobless among these two groups of families. And also they had lower access to food availability. As we said in the last slide, do you have enough food items to give your families a meal, 2 meals daily for the next week? In that sense also, they showed high food insecurity. And about government schemes, that is a very, very important area where, social protection measures or government schemes, which are supposed to act as a safety net for the poor and vulnerable communities. But the access, even the awareness was all right, not terribly high, but moderate, but access in both in rural and urban areas, and particularly in urban areas, the access to benefits was very, very low. Now, this is just an illustrative graph. As you can see, for both rural and urban sector, the female-headed households jobless share is shown in red, and the male-headed household jobless share is shown in blue. So all through the phase of assessment, all the phases of assessment, the female-headed households have higher jobless shares. That's a very telling picture. Okay, next we come to the health area. So we can see the bar diagram. So we know that the urban communities were more affected by COVID-19. I think we all know that. But even in both the sectors, in urban and rural, we find around 85% they're saying, yes, we could get, this is not, by the way, not main earners. These are community volunteers whom we have mentioned earlier. So this is their responses. They were saying, yes, we could get, access to treatment. But, and they had good knowledge also of COVID testing centers. However, quite a few people, quite a few high shares said that COVID testing center was far away from the habitation, not only in rural, but even in urban. In urban communities, these are quite dense, maybe because the slum populations mostly. So 54% of the community volunteers, they said that the COVID testing center was far away from the habitation. So what were the major challenges about maintaining a COVID appropriate behavior? All the community said that wearing a mask all the time and maintaining social distance all the time, both were a big challenge. But there was also another point, like 30% with a sample size at nearly 6,000, you see, they said we do not have soap, water to frequently wash our hands. Even that is a challenge. But there was high awareness, that is an encouraging thing among urban communities about the COVID-19 vaccine as of December. And the respondents were also asked that who should be given the vaccine first, and mostly they preferred the elderly, they had about 65 years of age, and of course followed by children. They were also asked what are your, most important and trusted sources of information. And TV won all the way, the television was huge, and followed by radio and newspapers. Now, now we come to some responses to pregnant women. There were many respondents who were pregnant women respondents. So, how were their services, the services that they access from the government health facility, how were they impacted? Of course, following the lockdown, they declined, their access declined. But after that, between August, September, and December, their access to pregnancy-related services that's increased. Between June, July, and December, we have seen that the Anganwadi centers provide the ICDS services for the IFA tablets and all the other services for pregnant women. So most of the rural pregnant women said that the local Anganwadi centers were providing the ICDS services. But in the urban areas, the access declined between June, July to December by 20 percentage points. And another very disturbing response from pregnant women was that they were not getting enough food. As you can see from the following bar diagram. They were asked, are you able to eat 3 main meals a day? And these are the October-November results. As you can see, just around 60%. In both the rural, little short of 60 and urban is 60%. They're saying, yes, we do get to eat 3 main meals regularly. But as you can see, nearly a quarter are saying only sometime. And even 2 to 3% are saying never. So that is a very disconcerting fact. Now, another source of nutrition, that is the supplementary nutrition, is take-home ration. Fortified food and micronutrient rich food and so on. So that access declined again post-lockdown for pregnant women, lactating mothers of 2 to 5 year olds. Generally, it's given till 3-year-old. But it improved after June, July. As earlier pointed out, most of the access to services, particularly in the rural areas, the access to health services improved after June, July. And rural access to take-home ration was higher than urban access. Now, in December, we found that among respondents who said, they were first asked whether local Anganwadi centers are functional. Because only when they are functional that they are going to provide the services. Because there were also some Anganwadi centers who were open, but they were not providing services. So among the respondents who said that the local Anganwadi centers were functional, we found that 90% of the rural pregnant women and lactating mothers had THR access, which was very good. But in urban areas, a little lower percentages, 83% among the pregnant women and 3/4 of the lactating mothers had THR access. Now, another angle of the mother and child health is the child immunization. And here the respondents were mothers of less than 1-year-old child. So the graph will across all over the faces will show you very clearly that the urban graph, which is the access that the child received immunization last month, that is the response. What percentage of mothers said that the child received immunization last month? So the urban graph, which is the red, is lying below the blue graph, which is the rural, all through the phases. So clearly, the urban areas, it was impacted much more, but overall for all, it improved after June, July. Okay. Now we come to education, and we all know that it is one of the worst affected areas following the pandemic and the lockdown. And that is because the schools continue to be closed. Even now, things are not back to normal. And as schools closed down, then the online education became the norm. And that, of course, heightened the digital divide among the haves and the have-nots. Because many children, they just did not have the wherewithal to attend classes. So in October, November, we see that 50% of these, the mothers, of 6 to, sorry, let me just see. Yeah, somehow this is blocked a bit my view. I think rural mothers and urban mothers, more urban mothers than rural mothers, said that their schools were providing online classes. I think as far as I remember, 3/4 of the urban mothers. And mobiles were the main mode of education dissemination. Now, but even among those parents, mothers of 6 to 19-year-olds who said that their children's schools were open. They were providing open in the sense they were providing online classes, but their children were not attending. So why were they not attending? And no guesses here really. I mean, they had no access to smartphone, no computer, no laptop, or they had poor internet connectivity, or another thing, child had no digital skill at all. And also among the rural respondents, rural mothers, some mentioned that there was too much household, so they could not attend. So internet connection, as expected, as would be expected, was better in the urban areas. So 76% urban and 69% rural mothers reported that they had internet connection in the area. One very encouraging finding from the monitoring mechanism exercise was that parents, by December, most of the parents were willing to send children back to school if the schools were to reopen. Because in the among the rural communities, 95% of the mothers and 81% of the urban mothers said they would send their children back to school. And you can see how much of an improvement it was compared to August, September, because during that phase of assessment, 61% urban respondents said that they would send their children back to school. But, and 81%, even then rural percentage was higher. They had said they would send it back. Now we come to child protection and gender-based protection. So really, I think most of us have heard that because of the lower income, depressed wages and so on, parents have been, are being pushed to get their daughters married off. And but this particular study did not find so much evidence. Only 5% respondents with daughters less than 18 years said that since lockdown, their daughters had got married or engaged for marriage. So not a lot of evidence. But in terms of rise in violence against women and children, there was fairly strong evidence because community volunteers reported that more in rural habitations. And in December, the mothers of 6 to 19 years old children, among them 1/3 reported that there was a rise in violence against women and children. So as you can see from the next bar diagram, rural and urban average were the same, but there was a lot of inter-district variation in the rural areas of mothers who are reporting violence against women and girls, that they had witnessed some incident of violence against women or girls. And in urban areas, it was fairly similar percentages. Now, another aspect of why these child protection measures are important is that, again, due to depressed family incomes, children they may be pushed to work, and that is the evidence that has been found. So among main earners who reported 6 to 18-year-old children in their families, it was found that more than 1/5 of the rural respondents and 16% of the urban respondents, they said that their children were either doing paid work or were looking for such work. And 1/3 of such children were 6 to 14 years old, till when they actually have a right to education. They're not supposed to go there at all. So child engagement in paid work, again, I have already mentioned earlier that female-headed families were more vulnerable, and probably as a result of that, child engagement in paid work was higher in the female-headed families compared to the male-headed families. Now we come to one particular, what should I say, body, which is the PRI, that these Panchayati Raj institutions, they are in the rural areas, they have the pulse of the people. They are very much in touch with the community, and they are in a very good position to serve the people in such, in times of such crisis. And they actually did. Quite a few states have reported like that. And the study also got evidence that they have been active in various ways, from using, like maintaining, raising awareness about masks and so on, social distancing, facilitating Manrega job provision, even quarantine, food distribution, then wage payment, and of course sanitation, by cleaning of drains and sewerage, as well as in THR distribution to pregnant women, lactating mothers, and so on. So they have played an extremely active role in promoting COVID appropriate behavior, the PRI institutions. Now, I have kind of tried to present some kind of a bird's eye view for this study across various sectors. So what are the main conclusions? Obviously, it is very apparent there were huge social and economic costs for the marginalized communities, and of course for children in particular, post-lockdown. And food shortage and job loss are huge crisis. Then what were the lifelines? PDS and Manrega, which is an encouraging finding, and these obviously should be strengthened. And access to health sector services, yes, these improved pretty much throughout after June, July, although initially there was a decline. Education was not in a good state because digital divide disrupted children's education. And one very disheartening finding was that the major schemes, even schemes like Beti Bachao, Beti Padhao, very, very low access was reported by the sample communities. So where do we go from here? Looking forward, just pointing out some of the possible ways. One is, of course, yes, since there is so much loss of livelihood, we need more livelihood options, but we also need better livelihood options, because we have seen that lower wages were reported by December compared to the pre-lockdown period. So clearly people are not accessing good quality employment. Maybe skill training is an option, so one can go to better, kind of livelihood options. And I have already mentioned that there were some procedural bottlenecks for accessing Manrega job cards. Those must be addressed and ironed out. Ration cards, not yet universal, particularly in urban areas. So one needs expansion and provision of ration cards. Now, it has been reiterated that home returnees are female-headed families. They were very vulnerable, much more vulnerable compared to the average household. So they might be targeted, particularly in terms of providing cash transfer, provided resources for it, of course. And pregnant women, again, this was a very disconcerting finding that they have food insecurity having huge implications for the unborn child and the women. So maybe they might be, helped by targeted PDS. We also need to improve THR access among such women, pregnant women, lactating mothers, and mothers with young children. So we found that media is a very, preferred, conduit to kind of disseminate information, particularly TV. And I think there was another in our last presentation, one government official Karnataka. She also mentioned, YouTube being used in a big way to disseminate information among the PRI officials or to train them. So that is also a very powerful tool. So internet links are also shared. So such kind of social media is also another one. So WhatsApp groups, all kinds of things can be used to increase awareness about the need for social distancing and masks, because COVID requires this kind of thing and it has not gone away yet. But of course, it may not end here, because the way things are changing in the world, we may be facing other risks, other calamities. So people have to get around to a more scientific behavioral, a scientific temperament. And they have to understand that there may be need to observe certain behavioral patterns. So that kind of awareness is needed. And in slums, of course, social distancing really doesn't hold a lot of meaning. So one can focus on masks. We've already mentioned women-headed households, pregnant women, lactating mothers and children. But here they need special focus for implementation of social protection schemes. Such schemes are clearly there is a gap in implementation. Of course, I mean, COVID was a very unprecedented calamity. I mean, the world hasn't seen anything like it. So the response had to be delayed. No one, can foresee the kind of thing it eventually became. But still, we need to make our social protection schemes, the way they're implemented, resilient, maybe a bit more resilient to such shocks. In education, certainly we need expansion of internet connection and access to smart devices to the extent possible for the marginalized communities' children, so that they can resume their education. But please remember that they do not also have digital literacy. Many of them do not. That was one of the reasons why they could not attend classes. And their families, I mean, most of these sample families, more than half of them were illiterate or they were educated till primary. So the family members also do not have digital literacy. But that is something which really has to be corrected in the medium term, because as we can see, technology is here to stay. We cannot just deny it, so that has to be given a special focus. Now, about child workers, yes, reopening of schools may act as a preventive factor for child workers, but we do need effective government's oversight for tackling this issue. And we have seen throughout that in rural areas, somehow the responses work better, maybe also because urban areas were worse affected by the COVID pandemic. But even the institutions might be more resilient in rural areas. I don't know. So that has to be seen. But we do need in the urban areas, particularly in the slums and the very urban areas where the marginalized population live, we need appropriate institutional structures and mechanisms to deal with their problems. So with that, I come to the end of my presentation. Thank you for your patience and thank you for listening to me.
Thank you, Dr. Tanuka, for this very informative presentation. And I request all the participants, audience, please put your question in the chat box. We can take them one by one. But before going to the question answer session, I would also like to mention that we are very fortunate to have Mr. K.D. Maiti from UNICEF with us today. And we would like to have his comments and reflections on the study. And Mr. Maiti is still here. Yes, thank you, sir. So Mr. Maiti is working with the UNICEF India office as planning, monitoring, and evaluation specialist. He provides leadership and technical guidance in monitoring and evaluation and overall strengthening of data system for children. And he brings more than 40 years of experience of working in this field in the government, as well as with international organization. He was an officer of the Indian Statistical Service and in the government as Deputy Director General, Ministry of Statistics. We are very happy to have you, sir. So please, we'd like to hear from you now.
Thank you. Can you hear me?
Yes, we can hear you.
Thank you so much. Before I begin, I'd like to thank EGROW to have given us an opportunity to present the first phase of our study, because this is the beginning of our endeavor to collect evidences about the impact or the effect of pandemic on the marginalized families, especially
Audio is
children, adolescents, and women in the community. So this, can you hear now? Is it clear?
yes.
Okay. So, so this whole concept of collecting evidence from the community emanated sometime in the month of April 2020, when immediately after the government declared that COVID-19 is some kind of a notified disaster. And we in the UN system, especially in UNICEF, we were already kind of predicting what would be the impact of the COVID pandemic and who would all be affected more, given that the marginalized families and the people living in these families are already multidimensionally, deprived on many aspects. Given this kind of situation which was emerging due to closure of establishment and quarantining the people, movements were restricted. So obviously there was not only fear among the people during that time, and I'm sure all of us who are here will remember those days. It also brought so many challenges in the lives of the people. Now, information around how it is affecting the people was trickling. Mainly, it was trickling through newspapers and some visuals on the electronic media. We saw very pathetic visuals of marginalized families struggling to go back to their homes. So it was quite clear to us who is facing or would become more vulnerable due to the pandemic. The children, obviously, the adolescent, mothers, pregnant women, lactating mothers would be the most affected, and they will be severely affected both directly as also indirectly. So it is in that background that the UN as an entity who are working in this in the country, they decided that let us do a quick assessment, a rapid assessment of what will be the extent of that effect. So in this background, there are 2 or 3 critical aspects which were kept in mind while designing. This entire thing was designed in UNICEF. The critical aspects were that since the pandemic was evolving, nobody knew what is the crest or the trough of this, the wave of infection that is affecting people. So it has to be a monitoring mechanism, but at the same time, it has to have a kind of a longitudinal design. So therefore, a decision was taken that we build onto a cohort of families from the marginalized families who would be measured over a period of time. And that's why Professor Tanuka mentioned that this entire study was done in 4 phases or 4 rounds, as we called it. One is in June, July, and the first one, and then the last one we did it in December 2020, which helped us in measuring the trends, what is happening in terms of all those slew of welfare measures which the government took. Is it having some effect of it or not? And most importantly, as Professor Tanuka mentioned, that we wanted to provide this evidence to the policymakers quickly so that they can take some corrective measures if possible, if the resources allowed, and both at the national and state level, because as UNICEF, we work in 17 states. So we have 13 offices. So all this information were being shared with the state governments also through our UNICEF offices. And at the same time, it was critical at that point in time that the evidences that was getting generated over each of the rounds are used in a strategic manner to convey the right kind of messages around COVID. So that was very, very important, that messages are released and they're truly evidence based. So it is at that point in time when we're looking for some quantitative information or even qualitative information. Most of the data ecosystem, whether you call it the MIS, the administrative data, survey systems, were not functioning. Obviously, some of the design challenges that we have, like for example, most of the MISs in our country, bigger ones even, they're largely manual driven. So when people are not coming to offices, they're scared and quarantined, those MIS systems stopped functioning. And now I believe slightly, slowly, they're able to come on board and provide some information. But during those days, it was completely, there was a blackout kind of a thing. Obviously, surveys, as you all must be knowing, the bigger surveys from NSSO or in the National Family Health Survey, which provides huge lot of information, they're all stopped. So all those issues were emerging, that where do we get the evidence? It is at that point in time we try to design a cohort-based longitudinal design, but the critical importance of this design or this monitoring mechanism is around working with the civil society organizations, and it's unique in the sense that not that the CSOs are not involved in data collection, but in a larger scale, in an integrated manner, the CSOs have never been included, though they are the ones who are living in the community and sharing the happiness and the pangs and challenges in the community. So we partnered with 13 civil society organizations led by Vadana Todo at the Delhi level. So we were in 12 districts. So each district had a CSO who was responsible for 300 community volunteers who were working on these in the CSO. So this is a kind of a structure, a 3-tier structure. We have one structure of CSO at Delhi who was coordinating with the CSOs. The second structure is at the district level. Each districts were, managing 25 habitations or villages, slums, or peri-urban slums. So that is the structure. And within those habitations, we had on an average 6,000 families in the each round from where this information was collected. So we had 6,000 families, but we had around 11,000 interviews per round. That means for each of the rounds, on an average, we had interviewed 12,000 respondents. And who were our respondents? We knew our vulnerability lies with pregnant women, because they would be the one who will not get the services. Who was our respondent? Lactating mothers, because ICDS were closed. How would they get their nutrition services, which is entitled to them through the ICDS system? Our third respondent was mothers of child below 1 year. This is mainly to capture challenges of closure of ICDS and also immunization story. We also had a respondent in the form of mothers who had a child 2 to 5 years, to capture preschool education, which is the early childhood education, and also ICDS along with it. Then we wanted to capture about schooling, about children who are aged 6+. So we had mothers who had a child of 6 to 19 years, not only to capture about education, but also about, as Professor Tanuka said, on many of the child protection issues, on marriage, the children's engagement with paid work, the household chores. So overall, if I may mention here, is uh, we had in the fourth round, if I may take you to the fourth round, we had a sample of 593 pregnant women in the study, around 1,400 lactating mothers, 630 mothers who had a child below 1 year, around 1,300 mothers who had a child 2 to 5 years, mothers who had a child of 6 to 19 years, we had around 2,500. So overall, we had a very robust sample from where these informations were collected. Now we also, since we were more interested in collecting information from the marginalized families, so we wanted to ensure that we have the right kind of vulnerabilities captured in that sample. And one of that is, how do you capture it? The sample had around half of the main earning members of that family were either illiterate or it is low level of education. That is either primary or below primary level. We know there is a huge association or a correlation with a low level of education with employment, which leads to low wages and then vulnerability within the families and with the family members. The sample also had larger number of scheduled caste and scheduled tribe. Almost 50% of the sample families were from the scheduled caste and scheduled tribe families. We also, because I said that we were seeing people coming back, so you will find in the report a lot of disaggregation by the kind of uh, employment these families, main earning member were building. So that is one area of stratification that we did when we designed the sample selection process. We kept intentionally, purposefully, a sample of around 25% such families who have returned during that pandemic time to their homes, that is mostly in the rural areas at that point in time, coming back from the urban side. The purpose why I wanted, and I had a discussion with Professor Charan Singh yesterday evening, he was so kind to talk to me, and I said it is very important that the context of the results that Professor Tanuka will bring out should be brought in, that we actually reached the most marginalized to see over the period of time how these kind of families were faring, including their members within it. So concluding, what we see is that through this study, I'm not going to go into the results, which Tanuka has very nicely presented in a very comprehensive manner. One is, as we see in UNICEF, is that our social services, whether you call it health services, ICDS services, or even the school services, are not adequately strengthened from the shocks. Now that shock in this case is pandemic, but we all know that India is not without shocks even without a pandemic. We have many kinds of climatic challenges, and there are, my DRR colleague tells me 80% of India is prone to some kind of a disaster, either through a flood or the no rain or similar such issues. So, and we all have seen how when there is a flood, how the services of health, nutrition, and wash and many other sectors, because of paucity of time, I'm not going and enumerating them, they affect it. So it's time that we really make our system stronger, knowing that these calamities and most largely the climatic calamities are going to affect more frequently. And lastly, it is very close to my heart, is that how is the data ecosystem in the country? Now, given this kind of situation, whether it is not going to certain districts in Northeast, or not going to XY states because there is a disruption. So how are you going to collect data in such situations? Is our systems so designed that it is capable to collect the data quickly to really, bring it to the policy people so that they take decisions on evidence based? Now, world over, I was attending, the World the Data Forum conference, organized by under the aegis of UNDS. They are saying that citizen-based information is going to be the critical data gap tool. I mean, who is going to wait for 5 years to get an estimate of whether it is nutrition or is it whether ICDS things are functioning or not? What government needs is quicker analysis, disaggregated analysis, and a reliable information. Now, reliable information may be defined in many, many ways. So that probably we will require one more winner to understand what is the reliability of information and how the reliability connects with the policy making. Do we wait for 5 years for policy making to get a reliable, or we go to the community and get the information which can help us to triangulate and validate that information? We don't do much of triangulation and validation. Having worked in the data ecosystem in the country, having come from that service, for 30 years, I've seen how data is only trusted when it comes through a survey. Many a times, I think all of us here, we know, even the survey-based systems that estimate that it throws out are not so robust. I will not go into the examples of that. So all has got its own, pros and cons. I don't say that citizen-based information is probably the only way, but it is a good tool to validate and good tool to provide, if not real-time, some real-time information to the policymaker, and let them not wait for some new survey coming in some 5 years and we get some idea to take care of our children, adolescent, women, and poor and the marginalized. I stop here. Thank you.
Thank you very much, Mr. Maiti, for giving us the complete description of the sampling technique and emphasizing on the data ecosystem. Like a true statistician, you have emphasized this. And I'm also very happy that you have talked about Northeast. That's an area actually usually people do not wish to go. We don't have so much kind of data, continuous data on Northeast, and we at EGROW are actually very keen on working on Northeast, and we have also thought of certain research areas for Northeast. I'm very happy that you have mentioned that. And now I open the floor for questions. I don't see much in the chat box. I have not seen many questions. But
I think Professor Charan Singh, Professor Charan Singh has got a question, I think.
Yeah, that I'll come to him. So if you have any question, then you may also off your mic and speak to the mic. Now I begin with, we have with us Professor Charan Singh has a question. We have with us Ashok Bisandas sir. He may also have a question. And I see one or two questions in the chat box. We will begin with them. Professor Charan Singh.
Thank you very much, both of you. I think Professor Tanuka and Dr. Maiti for informing us such an informative lecture and so much of depth of the analysis that has gone in. My questions, because you have covered it so well and so elegantly, so probably my question is very plain and simple, and probably you have covered it and I didn't capture it. Dr. Tanuka, my thought was that when you did this survey, my own worry was that there'll be, other than domestic violence, there'll be instances of anxiety, worthlessness, depression at both ends, the children as well as the mothers. Now, there is a probability because you did it in the first round. Nobody knew the length of the pandemic and the lockdown, so they were still in a thought that this will soon get over and this is nothing to worry about, and therefore that wasn't very important. So my thought was, did you cover this, or did you not find sufficient evidence to report? Or if I've missed, please correct me. The other thought was that because of stress, and there were studies abroad, was there any stress noticed in the family system in terms of separation or divorce showing up in your interaction during this? When even there's return migration, the family which was generally not staying together on such a long time is now closed in a small room. The children are there, the elderly parents are there. So was that stress showing up in different ways or culminating in the extreme that I mentioned? Dr. Maiti, you were so right, and I think your presentation style is so beautiful that you cover everything so well. But still, my thoughts were that when you chose the stage and you chose the districts, what was the thought behind those states and choosing that very district? I understand that you were looking for a certain sample, women, lactating mothers, and mothers of children of that age specific groups. But then the selection of states and the districts, was there any special consideration of choosing those, or was it really random? Thank you.
Thank you, Professor Singh. I think we will collect a few questions and then together you can answer. So, Vision Das, sir, do you have a question? I saw you raised your hand. If not, there is a question by Mohana Roy. Do you want to ask your question? Mohana Roy? This is a question on, you can see in the chat box, that is there a possible relationship between lack of education and children being in the workforce? So that's a kind of a question, especially in the female-headed household. And
if I may.
Yeah, you want to ask the question yourself? Yeah, please.
Yes. Thank you so much for the presentation. My thought was related to one of the points that came up during when Professor Endow was talking about the results that were found. And I was wondering if there is a possible relationship between children being in the workforce, and of course that's also due to them not being in not having educational opportunities. So that, and which was, I think it was particularly found in the female headed families, and I'm wondering if that has any relationship with a greater vulnerability towards gender based or sexual violence and crime, and particularly during this a pandemic or this kind of an adversity. And in terms of the socio-economic impact, my thoughts were about how this is, if at all, possible factor that contributes to an adverse socio-economic outcome, and therefore its importance in terms of policy making. Thank you so much.
Yeah, is there any other question? If not, I would also like to ask a question. My question is, one is already Professor Singh has asked about the selection of locations. And the other is that it looks to me that you have collected a panel data, the same household you have visited. So what kind of dynamics you have seen? If you can little bit give us some examples and the association association with the caste, association with the economic situation and other attributes of the household. What kind of interesting association you have seen and how it is changing over your period of different points of data that you have collected? So I think you can answer briefly these questions in the first round, and we can see whether there are any more questions. So Professor Tanuka.
Yeah, I think Dr. Singh asked about incidence of anxiety. I mean, generally, I think mental health issues, right? So,
Yes.
You see, UNICEF conducted the assessment. Sir, yeah, I was just talking about your question. So you were talking about the mental health issues. Mostly, in fact, I myself have heard of anecdotes where, you know, children who have grown up in the COVID times who are scared to even when somebody comes to visit their house. They're so unused to seeing people like that. And in the slum area, obviously, I don't think that kind of thing would have happened. But still, the kind of anxiety and stress level would probably come more due to more of economic reasons, maybe. But I don't think such questions, there was a fixed format of the question. Mr. Maiti can also maybe comment on this. So this mental health anger, I think it needs more probing. These are not, you know, something which you just go and canvas or you just ask. These need to be more of qualitative interviews. So I don't think that kind of canvassing had been done, which needs to be unpacked, you know. These are not straightforward like, you know, what's your occupation? It's not something like that. It is a deeper question. It needs to be probed. So that is a very, very important aspect. Sorry?
Please go ahead. I think
Somebody's mic is not.
Please off your please hello, please off your mic. Please off your mic.
Yeah.
Or at EGROW, you can admin
Please mute
can
the mic. Please mute the mic.
Hello? Yeah, I think Ms. Mohana Roy said something about, you know, whether the children are being pushed to work where there is less education. These things usually, of course, go hand in hand, you know. The causality to kind of establish a causality, you do need a large enough sample because a child worker, you know, or somebody who is looking for work, that kind of causality has not been analyzed because always you do not get, because these are subsets of subsets, you know. So you do not get large enough sample where you can say, first of all, it's an association. You can say it's an association. But causality is, without fitting a model, I don't think you can really establish here. But yes, female-headed families, it really points out to that because you are more economically stressed, and then obviously your children will be not so much because they're studying, but as it is, education is disrupted, but they will definitely be pushed more towards supplementing the earning for the family. That's what I feel. Okay, I think that's all from my side. Mr. Maiti.
Mr. Maiti, you want to add something?
Yeah. So, you know, we all have to understand that for this kind of service, there are certain limitations. When you do a remote survey, the limitation is that you can't engage with your respondent for a long time. Research globally has shown to get effective results from a remote kind of a, not doing a face-to-face survey, but through your mobile, not more than 10 minutes, not more than 10 minutes of attention can be attracted for this. So what happens is that many times as researchers, we tend to ask many questions. As Dr. Tanuka said, if you really want to understand the causality around mental stress and other things, it can't be one direct question. You have to ask several questions to get a true answer. Correct? And so therefore, that limits us to a small set of questions. And if you look at the questions, and I can share that set of questions, our questions have not been very direct. I will give an example. How did we collect information around domestic violence? If you ask this question, that has there been any incidents of domestic violence in your family, nobody will say yes. Nobody. So how do we capture information around domestic violence in the community? We ask little differently, and that's what even others were doing it. That is, we ask, have you seen?
Yeah, very common.
Or observed any kind of incidents of violence against girls and women in your community? We can't ask that, even NFHS, which provides us with some estimates of violence against girls and women, there are special trainings, because I have led NFHS when I was with the ministry. So there also you require special training to call out that information, because it's very sensitive in the family, and also the ambience in which we collect that information. That's very, very, how do you create that rapport? So when you are doing a remote thing, you have to be very careful and clever to call out that information. On child worker, we did ask a question. See, in a real classical way, child labor and child worker are two different concepts altogether. Correct? So when we ask them about the paid work, so we asked to the earning member, that means the head of the family. We do make a distinction between the head of the family, and in our case, our main respondent was the earning member, main earning member, because it is he or she who would determine many, many things. So we asked that, is there any child in your family below 18 years who is seeking or engaged in paid work? That's all we could ask, not more than that. So we do have a sense of what is happening in the community when it comes to these kinds of protection. The same was on child marriage. Same was on child marriage. But let me come back to a very important question which Professor Singh asked me, that how did you select the state and the districts? So intentionally we went to, as I had mentioned in my presentation, we work in 17 states and we have 13 state offices. So we have around 500 people who work in UNICEF. So our 7 states are UNICEF programming states, very straight. But which states are these? These are the states which had the higher level of infection during April, when the state was getting selected. April 20, Ministry of Health and Family Welfare were declaring on a day-to-day basis what is the level of infection by state and by district. So we picked up the worst performing states, plus we had other limitations. Some states did not want a community-based monitoring to be done, so we have excluded them, though we wanted to go there. I don't want to go into details of that. Having reached the state, it was district selection. So there were 2 criteria for district selection. We wanted to go to the urban areas, especially to the slums and the peri-slum areas. So all the habitations were around the slums, because the infection was in the slums at that point in time, and the deprivations that we are seeing because of the COVID was also in the peri-urban and in the slum areas. When it came to the rural areas, we had a number of discussion with our CSOs, and we wanted to go to those rural districts where we have larger proportion of casual workers or those who are in the informal sector and a concentration of home returnees, because we wanted to bring home returnee families into the sample. So these were the broad, criteria on which we selected the state, district, the rural, and the urban habitations. And mental health, Dr. Tanuka, I want to add further on to that, is that it was in the second phase, UNICEF is quite strong on pushing for mental health.
So we have now, we may have just one more round of if anybody has any more questions. One is Krishnanand Tripathi has a question. Mr. Tripathi, do you want to ask your question?
Yes, my question is to Professor Tanuka. I just wanted to ask, what are your views on national education policy? Because some people say national education policy, though it was launched last year after the first wave of the COVID-19, it doesn't have anything to deal with this kind of situation in future. To that extent, this policy is flawed. Because you work in social sector, so what are your views? How can we update this national education policy so that it can deal with this kind of problems in future?
Okay, thank you. That's a good question. And any other question? We will have, this is the last round of questions. Any other question? Please unmute yourself and you can ask. Okay, I think there is no question. And so any one of you can just give a brief answer to the question of Mr. Tripathi.
Yeah, see, this is actually not really pertaining to the study, but yeah, national education policy, it is actually quite a well thought out document. A lot has been, lot of area has been covered from what I could see personally. I'll just answer this as per my understanding. But in terms of implementing it and realizing it, I think there is a huge, long way to go because it needs a lot of planning and a lot of blueprint. Like teachers, from what I can see, is a main area where we have to beef up. But as you say, with the education dissemination, I don't think we can totally shift out of like a brick and mortar to online. But of course, it will probably be more hybrid as the workplaces will be in the coming years. So some technology will definitely come in. For that, there will indeed need to be a lot of planning and a lot of staffing. All I can say is a lot of issues has been discovered in NEP, which I thought were very good, that such issues should be raised. For instance, language is a huge issue. When, skill development has been touched very, very well. But in terms of implementation, there is a long way to go. Only that much. And of course, resource requirement. I'm not even going there. Okay.
Okay. Thank you. Thank you. So I think you all agree. I see message also in the chat box. You all agree that we have a very informative and very interesting seminar with a lot of policy relevant findings. Thank you very much, Dr. Tanuka, as well as Mr. Maiti, for sharing with us your valuable finding. And the last word, over to Professor Charan Singh.
I must thank the chair of the session, Professor Meenakshi, for having conducted the session so very well, giving everybody time and ensuring that important questions are asked and answered. I must thank the two speakers for sparing time at such a short notice. I just spoke to Professor Tanuka, I think on Monday, and we got it done. And then I spoke to Dr. Maiti only yesterday evening. And then we requested him to please join and give the context. So both of them agreed at such a short notice, and I must thank both of them for delivering such a informative talk to us and sharing the findings, such painstaking work which has been done, the thought process which has gone, as both Professor Tanuka and Dr. Maiti mentioned. You can't ask direct questions when you're doing such interviews on phone and during such difficult times. So you have to ask them in a very different way and then interpret it. So I must thank all three of you for being here with us today. There is an important announcement to make. This Friday from 4 to 5, Professor Ashima Goel, the right now she's of course on the RBI's MPC, but before that she was on the Prime Minister's Council of Economic Advisors. Ashima Goel is going to be speaking to us on drivers of growth in the post-pandemic period, post-COVID period. I would invite all of you to please come and join like this and participate in that. I'm sure it's going to be very informative. Today's lecture, I'm very sure, is pathbreaking. The reason being, there is no such study conducted on India right now, and this is the first study which has been conducted. I totally agree with both the speakers. It provides an opportunity to the government to come out with corrective measures if necessary, given the resource base. We will be putting the study on our website tomorrow by noon. You are welcome to use the study for education purposes or sending a copy of it to the ministry or concerned officials and ensuring that everybody knows about this research and its policy implications. I think that will be great if initiatives which the study is pointing out are taken in time. With this, let me once again thank the speakers and the participants for spending time with us. Thank you and have a good evening and see you on Friday. Thank you.
Thank you very much. Thank you very
Thank you.
much.
Thank you.